guys, what's up my people? I hope you are all doing well. Welcome to my YouTube channel and welcome back to Talk to Your Midwife session. To my new subscribers, karibuni sana, and this is the place to be to learn a lot. So kindly remember to hit that subscription box and subscribe, and let's learn together. And also to my returning subscribers, thank you so much for your support and thank you for your continued appreciation of my content. Now guys, today we have a very special thing and a very interesting thing that we have to talk about. So welcome and enjoy. So uh, we are just talking about labor, pregnancy, and this is something that is so much interesting for everyone to hear, whether you are a man, whether you are a woman. And today I want to talk about the signs of labor, and not only labor but the signs of a true labor, because we also have some false labor which might come due to some reasons, one reason or the other. But I want to talk about the signs. How can you as a pregnant woman know that you are getting into a normal term labor? And when we say a normal labor, we mean a labor that comes when you are at term. And guys, when do you know that you are at term? When is your pregnancy at term? Your pregnancy is at term when you are from 37 weeks of gestation. Why do we say 37? Because a lot of people do argue that 36 weeks is when you take 9 months, 9 times 4 weeks, that is 36 weeks. So people think that 36 weeks is term because it is 9 months. But I want to tell you today that 32 weeks is not term. Why? It is because it is said that the unborn baby's lungs start to mature at 36 weeks. That is when the lungs start to fully mature. Meaning, a baby who is below 36 weeks of gestation cannot be able to survive outside the uterus, cannot be able to survive outside this environment, other than when they are in a machine to help in ventilation and to help in breathing, because the lungs of that baby has not fully matured. But from 36 weeks of gestation, the lungs are still maturing, and by 37 weeks of gestation, your baby's lungs have fully matured. And when you deliver this baby at 37 weeks and above, this baby can be able to survive outside the uterus. Meaning, when you give birth to this baby, the baby can even be able to breathe on its own or on their own, even immediately after delivery, without any assistance of oxygen, giving oxygen, or even putting the baby in any of the respiratory machines. So we say any labor that comes after 37 weeks or after 36 weeks, that is 37 weeks, from 37 weeks of gestation to 41 weeks of gestation, or to 40 weeks of gestation. More than 40 weeks of gestation, we call that postdatism. Postdatism meaning it is a post-pregnancy, a pregnancy that has gone beyond the expected date. So within 37 weeks, up to 40 weeks, that is a very normal time for one to get into a normal and natural labor. And that is when even a hormone called oxytocin is released in the uterus to help in a contraction, starting of the contractions of the uterus, and that is what will start in labor. And that is why we say also, in case you are at 40 weeks and you have not yet gotten your natural labor, there is a very high probability that you will not get the natural labor unless you go for induction of labor. It means that if at 40 weeks the uterus and your body has not yet produced enough oxytocin to aid in bringing up the uterine contractions, then it means when you go past, it will still not produce that oxytocin. And that is why we advise a lot of women, as long as you are you are at 40 weeks, do not continue waiting at 41, at 42 weeks for labor, because there is there is a very small probability that you will get into the natural labor. So at 37 weeks to 40 weeks, expect natural labor. And it is so funny, or it is so satisfying to realize that God created us women and created a pregnancy in a way that things are supposed to happen naturally. There is a way things are supposed to happen naturally. Well, like, take an example, although this is something that we will talk about some other time. Take an example of when you conceive. The way a sperm and an ovum meet and they get to fuse together to fertilize and all that, and the way your body will accept that zygote that is forming, these are things that always happen naturally, and the body is able to maintain a pregnancy up to term and all that. So also God created that pregnancy in a way that the body knows that it is already term now. It is 37 weeks, this baby is matured enough, and this baby needs to come out. So the body will produce a hormone called oxytocin. Oxytocin is a hormone which starts the uterine contractions. And in layman language, the uterine contractions are the labor pains that we feel as women when we are in labor. So that labor pain is called the uterine contractions. And as long as your body has produced the oxytocin hormones, you will start having the uterine contractions. It will work in the uterus to bring those uterine contractions. Now, we have several ways when a woman or you can know that you have gotten into a true labor. And these things can happen together, or also to some people, to some women, they can happen just separately. Okay, so let's start with the first one. So the first one is start of the uterine contractions. Okay, most of the ladies, a high percentage of the ladies will know that they are in true labor when they start having the uterine contractions. So how does the uterine contractions for the normal labor start? This is how they pain. It is like your baby is doing like this. You see, when like a lion, when a lion wants to attack or something wants to attack, this is how it is. Very furious, okay? Very feeling so huge, so high, so strong. So it is like your baby is doing like this. So when the baby is doing like this, and it's like the baby is trying to stand, your tummy, your abdomen, or that pregnancy, the skin, even the skin of your tummy tends to be very hard. Okay, when you just look at it, even by looking, it seems to be very hard. When you touch it, when you palpate it, it is so hard. Okay, so, and it holds you for some seconds, then it releases. Okay, then after, okay, you feel like, okay, this might be labor, or maybe it is not labor. Okay, then you just continue maybe doing your thing, you are at work, you just continue working. Then after some time also, that pain comes back. Then the tummy is like very hard, it is still holding you tight. The tummy is so tight, feels so tight for some seconds, then it releases. Okay, after releasing, you can even touch the skin, is so soft, it is boggy. Okay, but when that contraction comes, it is very hard. Even the skin, you can feel the skin very hard. You can even feel part of the baby's body parts. You can easily feel them. Then after some time, the pains releases. So that is how uterine contractions come about. And also, for a true labor, it will not catch you and release you just once or twice. No, it has to be persistent, because when the cervix is starting to open, it has to continue opening until you get to delivery. Meaning, when the pains start, when the uterine contractions start, they have to be they have to be persistent. It is not only once and stopping. No, it has to be persistent. So what happens once I feel the contraction now at 10 a.m., the next one comes at 10:05 or 10:10. Let's say even 10:10 a.m. Then another one will come at 10:20 a.m. So what happens? The contraction that came at 10:10 a.m. is, I can give it like a pain range of 1/10. Then the one that came at 10:10 a.m., I give it a range of like 2/10. Then the one that is coming at 10:20 a.m., I give it a range of like 4/10. And what does this show you? It is showing you that this pain is increasing in intensity. Okay, the pain, the feeling of pain is increasing. So it was a small pain, bearable pain, a big pain, no, a smallest pain, a smaller pain, a small pain, a big pain, a bigger pain, a biggest pain. As in, that is how we mean by increasing in intensity. It doesn't have to be constant. It has to increase in intensity. It keeps on becoming more and more painful as the labor progresses. So that is a sign of a true labor. And also it has to increase in frequency. Okay, so how can you observe that at home? This one, the first one came had a distance of the first one, and the second one has a distance of 10 minutes. The second and the third one has a distance of 10 minutes. But the difference between the third pain contraction and the fourth contraction is becoming nearer. Okay, so it is coming back more frequently than before. So that is how you get to observe your labor progress even at home. And that now, when you realize that the uterine contractions are increasing in intensity and frequency, then that one is just a true way that you're getting into a normal labor. Now let's look at the second point, the second way that you as a woman can get to know that you're getting into normal or true labor. The second one is rupture of membranes. That is the medical way that we call it. But now in the layman way, we say rupture of the waters or breaking of the waters. That is how a lot of people know. But as in medical terms, we call it rupture of membranes. Okay, and what is this rupture of membranes? The baby is covered inside the uterus. Okay, and we said in a previous video, the uterus has 3 layers. It has an endometrium, myometrium, and the outermost layer is called the perimetrium. Now the innermost layer, which is the endometrium, inside the endometrium we have something we call an amniotic sac. Now your unborn baby, or the fetus, we call it the fetus, and the fetus is inside the amniotic sac. And inside that amniotic sac, that is where we have the amniotic fluid, or the baby waters. That is where we have the baby waters. That is where we have the placenta, the umbilical cord, and now the baby himself. So the baby is in a sac, in a small sac, amniotic sac. So what happens during those uterine contractions? Because the sac is very, it is very like thin. Can you say thin? Yeah, it is like it is thinning as you near the labor. So during those uterine contractions, it gets to break those waters, that amniotic sac. Okay, once it breaks the amniotic sac, what happens? The amniotic fluid, which is water, it is just like tap water, guys. It is just like tap water. So what happens once the amniotic sac is broken? The amniotic fluid gets to come out. So the woman will observe the water flowing down, and it is like tap water. Normal amniotic fluid, take note of this, guys, normal amniotic fluid should be like tap water. So it is water. You can be able to visualize water flowing down. Maybe you're standing, or maybe you were just peeing. After peeing, you realize there is a gush of water, clean tap water flowing down. That is the amniotic sac that has broken, and the amniotic fluid is flowing outside. And guys, I will get to do another video explaining the different types of abnormal amniotic fluids that we have when your baby starts to get tired inside the womb, or they start having respiratory distress. The baby is not able to breathe. Most of the babies poop inside the uterus, inside the womb. And when they poop, the way that we can know that the baby has pooped inside, it is through the color of the amniotic fluid. And we have different stages and different management of that, and I shall talk about that. Is a story for another day. I will talk about that sometime later. So we are talking about the rupture of membrane. So also the only time the amniotic sac is supposed to break, or the amniotic fluid is supposed to come out, is when you are in labor. Otherwise, in case the amniotic fluid is leaking or coming out any other time before labor, that is an abnormal condition and you should get checked. Okay, so drainage of the amniotic fluid is also an indication that you are getting into true labor. And remember, your baby should not be inside the womb more than 24 hours after rupture of membranes without those waters. Once the baby stays in that womb more than 24 hours, that baby is at a very high risk of getting infections. Okay, and it is not good. So that is why we encourage mothers, even if you don't have uterine contractions, you cannot feel the pains, but you have drainage of liquor. Another term for the amniotic fluid is liquor, guys. Okay, so in case you don't have the uterine contractions, but you can feel the drainage of liquor, you can see the amniotic fluid coming out, rush to the hospital so that we can be able to manage you and get you bring in labor before the baby spends more than 24 hours inside that womb without those waters. Because even these waters, they get to protect your baby from infection, from injuries, from hurt and all that, and it helps the baby to keep swimming and swimming and swimming. When the baby wants to turn, that is what the baby uses, because it is like a lubricant. Okay, so once you see that, what I encourage the mothers to do, once the amniotic sac has broken or the amniotic fluid has ruptured, get a cotton wool, because a pad cannot be able to accumulate that water. Okay, it is not best. So get a cotton wool, put it inside your pant. Okay, put it inside your pant, then wear your pant, so that by the time you're preparing to go to the hospital and you're coming and getting into the hospital, what I will do, of course I will ask you several questions, and I will also assess that pad, that cotton pad, so that I will be able to see the color of that liquor, and also that one will guide me on the type of management that I will do on you. Okay, so that is also another way of realizing that you have gotten into true labor. Breaking of the baby waters or rupture of the membranes. So you might be having uterine contractions but still not having rupture of membranes. There are those mothers who will rupture the membranes even without any uterine contraction. Okay, so not in case you have one of these, just go to the hospital. For those, someone might ask, for those who have come to the hospital with labor and the amniotic fluid has not yet come out, what do you do? Sometimes, if your labor is perfectly well, we don't even tamper. We will just allow you to go into labor and we will deliver that baby. Sometimes the baby comes out, the baby's head is coming out and the baby is still inside that sac. So at that time, we will just prick that sac and the amniotic fluid drains. Or else, if the baby doesn't come out with the sac, sometimes when we are doing a VE, sometimes we will rupture the membranes. Okay, and the reason why I will still talk about this sometime later, why it is best for even the rupture of membranes to happen when you are in labor. It helps to hasten the labor. It helps to keep the labor quite faster when it is already out, other than when it is not yet ruptured. Okay, so the third way that you can know or realize that you are getting into labor is through cervical dilatation. Okay guys, but now this one is not for you. This one is not you. Okay, whoever will realize that you have cervical dilatation is the nurse or the midwife who is doing the vaginal examination, VE, the vaginal examination. That is the only way that we can know that you are dilating, the cervix is dilating. So we have said the baby is inside an amniotic sac and the baby is inside the uterus, and this uterus has a door, kamlango. So the uterus has a door, and for this baby to be delivered, for this baby to come out, that door must open, and that door is the cervix. So we need to keep on checking whether your cervix is dilated, okay, so that it can allow the baby to come out, or the baby to be delivered. So cervical dilatation is also another way that you can know that, or we now that one is not for you, because you can never you are not able to realize that the cervix is opening unless we do a VE. So a VE will show us whether your cervix is dilated and to what centimeters it is dilated. So that is also another way that we can be able to realize or to know that you are in true labor, because most of the false labors will not dilate your cervix. You'll just be having pains and contractions, but with no cervical dilatation. Okay, so your cervix, for you to be able to get into a normal labor and a normal successful labor that will lead you to giving birth normally, your cervix has to dilate. Okay, so someone will ask, so you can have uterine contractions but still not have cervical dilatation. Okay, but for the amniotic fluid to come out, okay, for the amniotic fluid to drain, then it definitely means that there was a space on the door that was, even if it is a very little space that just opened, so that it allowed the amniotic fluid to come out. Okay, so sometimes you might be having a very small dilatation, maybe we call it 1 centimeter, which allowed the amniotic fluid to come out, but still the cervix is not fully dilated, or else maybe even the contractions are not too much. Okay, so it is still normal. That one can also happen. So what happens when you don't have a good or what makes the cervical dilatation fasten? It is the uterine contractions, and also when your baby is touching that cervix. Okay, that cervix, that door is very much sensitive. So when the baby is descending or coming down and touches that place, it is stimulating that cervix to produce more and more oxytocin, and that one will mean that when more and more oxytocin is produced, it means that that oxytocin will cause more and more uterine contractions, and that means then the labor will still continue to progress. But in case the membranes had not come out, or the membranes had, there was no rupture of membranes, the baby is still inside that sac, there will be no direct contact of the baby's head and the cervix itself, meaning the labor will be slower. Okay, so there is uterine contractions, there is the dilatation of the cervix, there is rupture of membranes. Another thing that can make you know that you're getting into normal labor is presence of SHOW. SHOW, SHOW. SHOW is something like that is mucus like, kama kamasi. Okay, it is mucus like, it is a lubricant, it is like a vaginal discharge that you can see. Okay, now but this one is not a vaginal discharge, we can call it a cervical discharge or a cervical mucus. Okay, So before that the waters break, that plug that is covering that sac, there is a plug, okay? It is like a mucoid plug. It peels off and comes out fast, then the water follows. And that is why I will ask you, as a woman, when you tell me you're feeling the pains, I will ask you, do you have you noticed any vaginal discharge? Then you will say yes, and I will ask you how consistent, what is the consistency of that discharge that you're seeing on your pant, or on the tissue when you wipe yourself. Then someone will explain it is like mucus. Okay, so when you tell me I have some mucus discharge coming out or some mucoid discharge coming out, then definitely that one will tell me that you are getting into labor, even if you don't have the pains, even if the waters have not come out yet, even if you cannot feel anything else, but you can see the mucoid discharge. That is called show, and it is coming in from inside where the baby is. Okay, and it can only come out when the cervix is opening, even if it is a slight opening. Okay, so a show, presence of a show, is also an indication that you are getting into labor. Sawa sawa. Then the last one that can also tell you that you're getting into a normal labor or a true labor is descent of the presenting part. Okay, let's take an example. This is your tummy, or this is your baby. This is the presenting part. Okay, the presenting part is whatever is presenting, whatever of the fetus is presenting, whatever the baby will come out with, whether the legs, whether the buttocks, or whether the head. But a normal presentation should be presenting by the head. Okay, the fetus should be facing down, like upside down, so the head should be down. So there should be a descent of the presenting part. If it is the head at that time should be able to present or descend. It should be able to come down. And that is when you'll hear a lot of mothers saying, my pregnancy yesterday was at this level. Okay, but today when I woke up with the pains, this pregnancy had fallen back or fallen down, so it is now at this level. You can see. Okay, so there is that difference, because the baby is nearing labor. Maybe the contractions are still pushing the baby down, so there will be descent. So if the presenting part was this level, by the time you are in a normal labor and a true labor, you have the contractions and all that, there is descent. This presenting part is already down and touching the, or engaging in the pelvic cavity. So those are the, is it 5 ways in which you can know, or you and us as the midwives can realize or can know that you are getting into a normal labor. And I still want to repeat this. Not all women will have all of these things happening at the same time. Not all women will experience all of these things at once. Not all women will get to experience all of these points, all of these factors. Some women will have silent labors. By the way, we have women, and I want you guys to comment. There are those women who have had silent labors. They will just tell you, I just woke up feeling abnormal, I was vomiting, I was having nausea, I was diarrheaing, I was just feeling just like that, so I just came. I just came and get checked and see what is happening. Then when you go and do a V, you just find the mother is at 7 centimeters. They have not had rupture of membranes. They don't have they cannot report intensive uterine contractions or those severe pains. I mean, they can only maybe report whatever they're feeling, and also maybe the descent of the presenting part, or maybe the fall down or the fall back of the pregnancy. Okay, and maybe they will tell you the baby is not kicking so much. Also, by the way, when there is descent of the presenting part, because the baby is being pushed down and down, so the kicks reduces. By the way, towards delivery of the baby, now that day the baby's kicks reduces. Okay, so you cannot be able to feel the baby moving up and down, side by side. Okay, it is not like before. For that time now, the baby kicks will reduce. So whoever you are, whether you are a mom, whether you are a healthcare worker, whoever you are, you should be able to know that not all women will get to experience all of these things at once. So some women will experience one or two, okay, and that will get them into a very normal labor and a natural labor. So these things happens just naturally. Okay, and someone will ask, what happens in case I don't have those pains and I'm told that I have been 6 centimeters for some time? What will happen? Okay, so what will happen most of the times, you have seen us giving mothers drips. Those are waters. We just put a cannula here ama sindano, and then we infuse some medication there through a drip. I shall talk about those ones later, because we have to make sure for a labor to be successful, for a natural labor to be successful, to deliver a child, we should have all of these things happening. Okay, so for those who maybe will come with not having contractions, most of the times we will do we will do several things which will help to hasten or to bring more contractions and more labors. Okay, so that at least the mother can be able to progress to delivery. But we have also a very big percentage of women who have had just natural labor. The membranes rupture, you have the uterine contractions, you have your cervix dilating step by step and step, you push your baby out, and that's it. And then we have those mothers whose bodies are not able to produce enough oxytocin, or the bodies are not able to coordinate all these factors so that it can lead to a normal labor. Anything that happens, we as midwives and the doctors, we are always trained, like we know, in case this is not happening, we can do this. In case this is not happening, we can do this. In case this fails, there is always an option of anything that fails in a labor ward. Anything that is happening, there is always a solution. There is always an option B. There is always a solution for it. Okay, so you don't have to worry. So in case you're there, you have a term pregnancy in between 37 to 40 weeks, and you're feeling any of these signs, you have observed any of these signs, just rush to the hospital. Just carry your maternity bag, your packed bag, be ready for labor. Just go and get checked, so that at least you can be able to be managed well until delivery. If you're there, you're not feeling uterine contractions, but you can see some leakage, like your pant is getting so wet, you've not done anything, you have not peed on yourself, but your pant is getting wet, that should make you start suspecting that the amniotic fluid is coming out, because it doesn't have to come out as a gush of blood. Sometimes it just starts by leaking and leaking and leaking as it increases. So it is good just to go and get checked. Just use a cotton pad. You just cut a piece of cotton wool, then you wrap it like this. You just wrap it like a pad, you put it, so that when you get to the hospital, we can check it and get to see what kind of a drainage it is, whether it is amniotic fluid or it is something else. So those are the ways how you can realize that you are getting into normal labor. So I hope now we are well, and I want people to comment down below on the comment section. Comment and tell us, how was your labor? How did you realize that you're getting into labor? Did you get rupture of membranes? Did you get the uterine contractions? Let us get to comment, and so that people can learn and people can see how differently labor can present. Okay, so thank you very much, and I hope you have learned a lot. Kindly remember to hit the subscription button. Kindly subscribe, so that when I upload another video, especially on the process of labor, I have a lot to upload on that, so that when I do so, you will be the first one to be notified that there is a new video, and you can get to learn and learn more. So thank you very much. Until next time.